The next step would be a three-pronged approach, and that was really interesting because it clarified a lot of things. So first, do a clinical examination. And a clinical examination would basically need to be, one needs to look at the enthesis, look for dactylitis, look at, evidence of central disease, look at the peripheral joints, probably do a shake hand maneuver and press the fingers to see where there is early evidence of psoriatic arthritis or not. So after a clinical examination, do an ultrasound, because it was quite clear from the speaker's point of view that an ultrasound is much better than doing an MRI in the peripheral areas. And the thickness of the quadriceps tendon is something that was emphasized, that a thicker quadriceps tendon gives you an indication of a possibility of a psoriatic joint disease.
But that was predictable value, right?
Absolutely.
For future. Okay.
So future development of psoriatic joint disease. So that is one. The second thing, of course, is a Doppler. So a Doppler ultrasound. So edema of the tendons, thickness of the tendon, a Doppler ultrasound showing increased vascularity. So an ultrasound was found, what they found to be a very interesting and an accurate modality of diagnosing psoriatic arthritis early. Of course, this is for the peripheral joints. For the central joints, of course, it's always going to be the MRI rather than the ultrasound for quite obvious reasons. So after a clinical and an ultrasound, the third investigation which they have suggested is do labs, and CRP and an ESR, of course, quite obviously are the standard labs. So this is quite a, I found this to be quite a nice modality. So whenever we have patients with psoriasis, a lot of times we forget to ask questions such as early morning stiffness, whether he's got pain early in the morning which improves through the day. He's got shifting gluteal pain, which is a very common feature of psoriatic arthritis. Again, that's something which I want you to remember. So ask patients for shifting gluteal pain.